The question that I have for the panelists is, as you reflect back upon your experiences, what's been some of the greatest surprises or things that were unanticipated for you? That's the first part of my questions. And any advice to people moving forward, anything that you would do differently?
One of my biggest challenges has been sometimes feeling very discouraged. It's a long process, and you need a network of people to walk that with you, because changing a culture, as we all know, doesn't happen overnight, but we can say that a million times to ourselves and still feel sometimes as though we're walking in heavy boots. So speak with the people around you, draw inspiration and strength from them, and never, never be discouraged. This takes willpower and patience and time.
I'd actually echo that, even as an organizational leader from my perspective and what I've seen in our organization, because as we're really trying to do this from the inside out, and yet supported by a very clear direction of moving forward that has been informed by the voices of patients and staff. But every so often we'll go around and someone will be talking about patient experience advisors, and they'll say, "What?" You say, "What do you mean, what? It's been 3 years. How did you possibly miss this?" And that just, I just kind of some days said, "You just gotta go, oh my goodness." So there's pockets of amazing things, and it is drawing the energy from each other and from the learnings, and being really open around what's working well, and gee, we'll maybe try that differently the next time, and having that as a really open dialogue. I think one of the things that is really important too, from a learning from we've talked about this. I don't go to all the patient advisory councils, but I do visit, and I like to get invited or go, because I actually find it hugely inspiring. But as we've been going forward, and this has really caught fire, if you will, now. We're at that phase where you kind of go, and then now it's growing, and now it's growing a little bit faster than we're trying to figure out how do we make sure that we can build and grow this without ruining the spirit of some of the informality of it, and one of the things that we've talked about with the advisors is, as people get really enthusiastic about this, and including the patients, we need to maintain a healthy tension. Because if the patients lose the telling you what it's like and what and what the real issues are, and you lose your ability to hear, that it can really go awry. Because if the patients become like a cheerleading club for your organization, that's nice, but it's not real in tackling the many issues that need to be there. So we talk about that very openly, about how to keep that healthy tension. And one more example, if I may, we kind of do these. We did a public forum on patient experience advisors a little while ago, and the patients told some of their very real stories that were their catalyst for becoming involved in this experience. And this was one of the unexpected things of kind of learning out loud, if you will. We had people in the audience who said, "I can't believe you let this happen," where people were talking about their really negative experiences with the organization, but it was coupled with what they'd learned, how we're working together, how we fix things, or how together we address things. But that kind of being out there, I think, was a really important part of our development, because it kind of became real. But there's still a lot of people who say, how can you let that happen? And so I'd say don't be afraid, because if you cultivate the conditions for a supportive dialogue of difficult conversations, and then kind of channel the energy that can get out of that in a positive way, that it can be really positive. So that's been a bit of a kind of a surprise of how powerful that actually can be. So don't do it all behind closed doors.
If I can just take 2 minutes to explain. Somebody asked a little bit earlier about physicians. I think that's one of the things that's really been exciting for us, and it is that I talked about how, we started with the BC Medical Association and patients couldn't speak. And now they include patients in almost every one of their working groups and committees and workshops and conferences. So I think earlier we talked about just the experience of having patients has really made a huge difference. One of the biggest challenges, to answer the other part of your question, I think is we have established a mechanism and invited people to come in and join the mechanism. But we really find that we have to reach out to those hardly reached populations, and we have to figure out ways of incorporating, people with mental health and substance use issues, Aboriginal people, multicultural groups who don't necessarily gravitate towards this kind of a concept. So for us, going forward, those are our challenges in the coming year.
Leslee, have you found that this transformational work that you've done has positively impacted your fundraising abilities at the hospital? And Anndale, I don't remember seeing your name on the annual Sunshine list of employees that are providing good value but are getting paid for it. Do you feel that you should be paid for the services that you're providing? And I'm making an assumption that you're volunteering, but clearly you're providing amazing value for Leslee and KGH.
Would you like to go ahead? I do not get paid, and I glory in not being paid, although it's hell to have a wardrobe to deal with all these fashionistas. Nevertheless, I don't want to become a cheerleader. I don't want to be I don't want to be looking for my paycheck in an organization.
At least a clothing allowance.
So I feel that gives us a great freedom. And at this point, I don't think that the direction we want to be in is too bureaucratized with more layers of people who are responsible for patient advisor, whatever it is. We at this point have an informal enough, trusting, mutual respect. Who knows what will happen eventually? It may get so large. But right now, it's working very well, and we all say whatever we want to say, no matter how hard it is. We had some people from a hospital on the borders of our province visit us recently, and people at Leslee's level and a bit below, and they said after our meeting, in our advisory council, we would be so scared to face a group of patient advisors who knew it. This would be terrifying for us, because we were speaking with emotion of those hard issues. They'll make it. They'll prevail.
You know what, I haven't given a whiff thought to the fundraising side. I think what we've been focused on is, I think building the trust inside. I think that the trust, the confidence, and delivering on our commitment to the community that through the partnering with patients, we are going to be able to achieve outstanding care always. That should have other kind of benefits. But that also speaks to I think that keeping it real about what you're really trying to do is so important. Because if the patients ever felt like a token, well, number one, they would tell us. And it's just, yeah, I think that if we ever also, we've talked about this, had them feel like they were being used in any way, it would fail. And it simply actually would stop.
Next question.
Eleanor Revort from Kingston General Hospital. It's great to hear from other organizations and countries about the embedding of patient-centered care within the organization and into the DNA. My question relates to how do we begin to embed it in our emerging professionals and particularly Helen and Jocelyn, if you have advice in terms of taking these practices, the competencies, and the concepts into the education programs where it'll really create that lasting cultural shift.
It's a very, is this on? No? No.
Yeah, great. It's a really good question, and I would say that it's very early days for that. The Royal College of Physicians is responsible for postgraduate training of doctors who are going to become medical consultants, and they traditionally have done, as part of their training, a clinical audit project. And the college is now developing an alternative to doing a standard clinical audit project, which is a quality improvement project with patient involvement, which I think that it's that kind of thing that we need to see happening. I'm not close to education myself, but of course see a lot of young doctors and young nurses and young therapists. And what older people in those professions say is that the kind of pendulum has swung, so that in the past nurse training in England involved quite a lot of discussion about patients and patient-centred care and dignity and respect and teaching communication. That's actually almost stopped. Many nursing schools are now teaching communication with patients through e-learning only, no sort of role modelling, in a safe environment. And actually the doctors have become much, much, much more taken up with teaching communication skills and assessing them as part of their examinations. So I think there's different elements to this. It's partly about creating professions who are receptive to what their patients have to say, but it's also about teaching them to work with patients as partners in the kind that you've been describing so beautifully here. And I think that takes actually putting them into situations where they can do it for themselves as part of their training.
Thank you.
One of the things that, maybe as someone else is answering questions, that was an interesting part of our journey as well. I'm reminded as you talk of, at the beginning as well, one of our other kind of core strategic directions was around implementing a whole interdisciplinary model of care, an interprofessional model of care that is now disseminated now through the entire organization. And Anndale talked about the kind of some of the training and the education of all the staff that the patients have been part of. But that was also a very real and almost practical way of, we actually started with interprofessional practice model, but it's now, the lexicon's changed even to, it's patient-centered care. And so that's been, they were involved with the design, the shaping. We didn't know what, maybe as brilliantly, what you described. It wasn't as neat, but it was disciplined and focused. There was curriculum. And then as people saw the value more of inviting the patient experience advisors, we created this role of patient experience advisors. And there is a role description, there is an orientation, and there are kind of the processes of support and mentoring of the, and collaboration at every one of our committees and councils. There's the patient experience advisor as a staff partner as well that they are linked to, so that you're both kind of looking out a bit for each other to have as a support for as you go. But it's kind of being tangible too around some of what you were clear about what you were originally trying to achieve, which is a big piece of what I see in the UK experience of being very focused on a particular process. And as we started to work more and more in the model of care, so many other amazing things have started to happen from that. And now the lexicon is changing to not being about the model of care, but being about patient-centered care in a very different way.
To go back to that question very, very briefly, one of the most exciting requests that the Patient Voices Network received a few months ago was actually from the School of Nursing at the University of British Columbia to have patients actually sit on the interviews, of young students that are coming into the program. Which is just, it's one step, it's the first step. And what happens when they're in the program is a whole other story. But at least it was going in the right direction.
We have time for one more question from viewers.
My name is Paula Blackstein-Hirsch, and it's really a question about what the impetus was for the creation of the Patient Voices Network. Because on one hand, I can appreciate that you need to have these individuals trained within the context of an individual organization, but I also can imagine the developmental work that KGH has shouldered in developing this. And I think that I'm wondering whether a network such as what BC has done could actually partly answer the question that was raised earlier about scaling and spread.
Thank you. I'll try to answer that briefly because it's a very good question. Back in 2008, the Ministry of Health developed a primary health care charter. And that charter was meant to guide the system transformations that were taking place all around the province. And probably the most important part of that charter was the patient-centered focus of the charter, with the words, in bold, nothing about me without me. So the tone was set, the course was set for the changes that were about to happen. And what transpired as a result of that was that a lot of money went into re-educating physicians and professionals. And very little money or attention went into what about the other side of the equation? How do we bring the patients into the, into the boardrooms and onto the advisory committees, etc. And so this is where Impact came onto the scene, and basically we did forums around the province. We brought patients together and said, so if you were to have a voice, what would you need? What would be, how could we support you? And that's where it was through those conversations that the mechanism that was developed for the Patient Voices Network, that's where that came from. There is no doubt that without the support of the ministry and the support of the health authorities and patients as partners generally, it would be very hard for something like the Patient Voices to survive. Because what's really critical is that those engagements be real and sustainable, and that patients be involved at the decision-making bodies. So it's not fluff or trivial engagements. And I guess that's what, because of the ministry involvement, that's what has allowed that to happen. Have I answered your question?
You have. Thank you.
Thank you.
Well, thank
Can I just add one thing, because I think it's important, and Anndale, maybe you can reflect on your conversation with when the patient experience advisors met with the Minister of Health, when Deb Matthews came to our hospital and talked with the group. She asked the question about whether or not this is something that could be mandated, or how far do you go kind of in the system, and you folks were pretty clear about what you thought.
Well, I thought you can certainly have the government and say we create incentives for you as a hospital to do this and this and that, but each hospital has its own personality. It has its own history, its own evolution, just as our health systems do. Yours evolved out of wartime necessity. Ours evolved differently. The Americans. So I really think we have to honor and allow hospitals to grow this, or healthcare facilities, clinics, to grow these things organically with as much support as possible, but to do it in the way that is right and fits them. Mm-hmm. We've moved from very different angles, all of us, mm-hmm. but we are moving towards the same kinds of goals, and this is why a meeting like this is so fruitful and inspirational.
Mm-hmm. Last word to our overseas guests.
It was just to say that I think I completely take what you say about the perverse consequences that could happen with mandating this. what we see is that what really makes a difference is leadership, and it's quite clear that at your hospital there is, that you provide that leadership, and that if you could just imagine a scenario in which an organisation is told it has to have a patient and family advisory council, but actually nobody in the senior team really gets it and wants it, then I think you could see how really kind of how almost destructive it could be, because all it will do is kind of fuel the cynicism that there is about the way that politicians tinker with the system.
I hope I didn't give the impression that it's mandated in BC. It is not mandated, because I absolutely agree with everything you said. It's just I think that we have there is definitely the support and the encouragement, and the context, for the work, but it is definitely not mandated.